Hi, Mary Lee Sears here, Systems Coach, helping you put systems into your practice so you can work less and make more. In this video series, I'm going to be talking about filling the gaps in your practice, particularly gaps in your schedule. A lot of you reached out to me and said that's the biggest problem that you're having right now is too much time or too many cancellations in your schedule. So before I talk about telephone skills or scripting or anything like that, I think it's important that we talk about the core issue. At least what I found out for me to be the core issue, and it changed everything once I figured this out. And the good news is it all has to do with you. So it's completely within your control. Now you've probably heard before that only 7% or less than 10% of our communication is verbal. The other parts are posture, our gestures, our facial expressions, the tone of voice, things like that. But what it comes down to is we take so much time to focus on our verbal skills. And we don't ever talk about those other skills that really communicate a message to our patients. That's what we're going to talk about today. And what I bring it all down to is energy. You have an energy when you walk into a room. And you have an energy when you're talking to patients. You have a different energy when you're talking to your friends. And what you want to do is you want to make sure that you're bringing the right energy into your patients and when you're presenting treatment, because it makes a big difference. Now, this is not only important for you, but it's also important for your team. How I figured this out is I was having a really hard time, and I was getting really frustrated at work. I had actually taken over my dad's practice because he was very sick, and everything was falling apart. My dad had a really positive, upbeat personality, but when I came into his office, there was no system in place. Things were just chaotic, and honestly, it was kind of a mess. Well, it was a really big mess. And my frustration level was sky high. It didn't feel like anything was working out. I was getting frustrated with patients. I was getting frustrated with team members. And I was just getting frustrated that this whole mess had landed in my lap. And one day I came across the quote, "Please take responsibility for the energy you bring into the space." I'm going to repeat that. Please take responsibility for the energy you bring into the space. That quote comes from Jill Bolte Taylor. She's a neuroscientist who in her 30s suffered a massive stroke. So here she'd spent her adult life studying the brain and how the brain operates, and then she was able to really experience firsthand what happens when the brain starts to degenerate, when it starts to slow down, when it can't process things. And she learned some really incredible things. After her stroke, she wasn't able to communicate verbally, and she didn't understand language for quite some time. But she said that she could still feel people's energy. When they would walk into the room, she would know whether or not they were bringing positive energy or whether they were going to take her energy. And she needed all of her energy to recover. And so that's how she then came up with the quote when she could communicate verbally, "Please take responsibility for the energy you bring into the space." It was really powerful because for her, she needed all her energy to recover. But your patients need your energy in order to trust you. Because if you're thinking, "I don't know if they can afford this, I don't know if they're going to accept this, am I saying the right thing?" And these are all subliminal things that are going on in the back of our head. But if we're not paying attention to them, if we're not aware of them, they'll control our energy and just suck it away. Instead, what you want to do is you want to think about the benefits to the patient. And I'll get into this next step in just a minute. But when you're speaking to patients, you want to make sure that your posture is nice, and you want to clear your mind and really bring your energy to your center. Now this sounds so woo-woo and so crazy, but it makes a difference. So smile, sit up, bring your energy to your center, and then think about the patient. Think about the benefits of the patient. That's the next step that really changed things for me. Is oftentimes when we're talking to patients about treatment, we're thinking about the financial benefit of doing it now versus delaying treatment, but we don't do a very good job of communicating the reasons of why they should move forward with treatment. We tell them they have a problem, we tell them they should fix it and how much it's going to cost, but we don't go into the details of why they should fix it, the problems that can arise if they don't fix it, and the benefit of doing it now. So I'm going to ask you to write down 3 things: financial, emotional, and physical. And when you're speaking to patients, you want to be bringing up at least one of these benefits when you talk to them about treatment. The financial benefit of getting treatment done, obviously, is that it's more expensive to delay treatment. Treatment never becomes less expensive if you delay it, if you put it off. The emotional benefit, they can schedule at a time that's convenient. It saves them from pain. It saves them from the embarrassment of having a cracked tooth or having a broken tooth or having to call after hours with an emergency. And then the physical benefit is obviously wanting to take care of things before they hurt. So many times we ask patients, so is that tooth hurting you right now? And if they say no, we're like, oh, good, that's it. So if we could also follow that up by saying, great, we always want to take care of things before they hurt. Or whatever the line is for you. But what I want you to do is to write down 5 benefits that are financial benefits, 5 emotional benefits, and 5 physical benefits, and start working those into your conversation. Now, in the next video, I'm going to talk about conversations and how to really get a conversation going with the patient so that they're enrolled in treatment and they're enrolled and trusting you. So I look forward to seeing you on the next video. See you tomorrow.